talk to me why you believe so deeply in fasting for optimum human health.
So, today it's pretty obvious if you look around, we have some pretty serious health problems. 72% of the population are overweight or obese. And although people would like to think of, say, overweight as just an aesthetic challenge or something, the fact is it's a very major risk factor for the common diseases that are killing everybody you know. Heart disease, cancer, diabetes, autoimmune diseases all have dietary excess as a root contributing cause. And what's interesting about those diseases, even though they're the leading cause of death and disability, they're treated as if they're completely independent entities. You have to actually go to different types of doctors even to be able to evaluate these supposedly unrelated conditions. Yet in reality, all of them have one thing in common. They're associated with inflammation, and that inflammation can be massively contributed to by not just fat, but particularly a type of fat called visceral fat. So somewhere around 10% of fat is often visceral fat, a type of tissue that accumulates around the abdomen and in the organs. And that visceral fat gives off inflammatory products that are the contributing causes of these chronic degenerative diseases. So essentially, if you say are 20 pounds overweight, you likely have a couple pounds of visceral fat. It's essentially like having a 2-pound abdominal tumor. If you went up to somebody and said, look, you have a 2-pound tumor in your abdomen, they wouldn't be shocked to find out that that's probably not helping their overall health. And in fact, that's exactly what's going on. So we have these large amounts of hypertrophic, hypermetabolic tissue producing inflammatory products because we got overweight. And we got overweight because we ate a diet that fools the satiety mechanisms in our brain. So we ate foods that had certain chemicals in them, and those chemicals allowed us to have to eat more before we reach normal satiety. And that's why people are fat, sick, and miserable. And the chemicals that we're putting in the feed that cause us to be overweight are salt, oil, and sugar. Salt, oil, and sugar aren't food. They're hyperconcentrated food byproducts we add back to food to stimulate dopamine in our brain so it tastes better. That's what tasting better actually means, is that whatever you're eating, it results in more dopamine stimulation in your brain. It tastes better because that's what it is, more dopamine stimulation. And those chemicals, the salt, oil, and sugar, do a better job of stimulating dopamine than whole foods themselves. So if you just eat a whole food diet, it becomes very difficult to achieve and maintain obesity because you eat a certain amount and you feel full. But when you salt the food, you add sugar and oil to the food, it's impossible not to overeat the food if you eat to satiation. So essentially, we talked about that in our first book, The Pleasure Trap, that people get fooled by the pleasure induced by these neurochemical changes into engaging behaviors that are not helpful. Some examples of the pleasure trap are drug addiction, whether it's alcohol or cocaine or methamphetamines or caffeine or nicotine. But another cause of the pleasure trap or the dietary pleasure trap is eating foods that have salt, oil, and sugar added to them. So now you have a population that's overweight. They're producing inflammatory products. They're developing diseases. I might mention those diseases used to be pretty rare. They were called the diseases of kings because it was only the wealthy elite kings that could eat the diets that led to the obesity. They were the ones that got the gout and the heart disease, et cetera. And so now they've become, very common. In fact, the leading contributing cause of death and disability. So once you get that, it makes more sense why we would consider something like fasting. Because it turns out that fasting is a way of helping undo the consequence of dietary excess. So when a person goes on a fast, their body adapts to fasting. The brain, which is your main burner of glucose, changes to burning fat instead of sugar. And so if you look at what happens to body composition in fasting, which is what we've done in a recent study, using a DEXA scanner to evaluate body composition changes in fasting, you find that people lose weight. Some of that weight is fat, some of that weight's protein, some of it's water, some of it's fiber, some of it's glycogen. And then if you look after the fast, people regain weight. But what's interesting is the weight they gain after fasting, assuming they're eating properly, is water, fiber, glycogen, and protein, not fat. The fat continues to come off, and particularly and preferentially the visceral fat. So, for example, a typical person that fasts for, say, 2 weeks would lose 10% of their total body weight, 20% of all of their fat, but maybe 40% of their visceral fat. And then when they go back to eating a healthy diet, they regain water, fiber, glycogen, and protein. In fact, the lean mass at 6 weeks after fasting is actually higher proportionally than it was at baseline. All that's happened is they've transformed their body composition and dramatically eliminated fat and preferentially visceral fat. Now, granted, you still have to do the dangerous and radical things like eat well and exercise and go to bed on time in order to sustain the results. But it's a very fast track of making that transition.
Dotsie began this with asking about fasting for health. And I understand from you now that one of the very important aspects of fasting is to lower body fat, which lowers inflammation. And that has so many health benefits. Is the same mechanism applied to trying to get rid of cancer tumors or high blood pressure or other diseases that you treat? And I just want to say in the beginning, folks, that that Dr. Goldhammer's patients are under his supervision. And so none of this should be done at home, just for, your own experimentation, because what Dr. Goldhammer is doing with his very sick patients is long-term fasting protocols, and those can be dangerous if not done under supervision.
So we're fasting patients from 5 to 40 days on water only. But every patient that fasts, first of all, you do want to review the medical history, make sure they're a good candidate for fasting. You need a physical exam and some baseline laboratory testing so you'd be able to determine, again, are you a good candidate, and have some reference point to be able to tell if the symptoms that come up in fasting are good things or bad things. It's important that people rest when they're fast. If they're too active, they'll lose more weight, but it won't be fat. It'll be lean tissue. And they need to recover carefully after fasting, particularly prolonged fasting, or it can be dangerous or fatal. You can get refeeding syndrome, post-fasting edema. There's lots of problems that happen if you take a person that's done a long fast and too rapidly realiment them. So you want to make sure that the protocols are followed. That's one of the reasons why we wrote this book, is so that people would have all the information they need in conjunction with their local physician if they want to fast at home, or coming to a place like True North Health Center if they're going to fast in a controlled setting. We do offer some support through our telemedicine practice. If a person wants to do a fast not at True North Health, they want to do it at home, they can do that safely if they work with their local doctor and they work with one of our remote coaches. We can certainly help them figure out what to do and how to do it. And the book provides all the information the patient and their doctor needs to know to understand what testing needs to be done, how to monitor that, what the significance of the changes that occur in fasting are. So fasting is a biological adaptation. All the human beings that couldn't fast, that couldn't change their brain from burning sugar to burning fat, they all died. And we know that because all humans today, if you take calories away, within 48 hours, they've depleted their glycogen stores. Their brain changes over from burning sugar to burning fat. This is a biological adaptation. The reason why all the humans died that couldn't do that was because sometimes spring comes late. And human beings have massive brains that are our biggest burner of glucose. So if you have a human brain, you can only go about a week or so before you'd enter starvation and die. But if a human being could change its fuel from burning sugar to burning fat, they can go 10 times that length, 70 days or longer. Not that you should. I'm not suggesting people fast for 70 days, but you could, because you're able to conserve your resources in a way that you wouldn't be able to do if your brain kept burning glucose. For example, chimpanzees aren't able to make that conversion. You'll never see chimpanzees wandering away from the tropics, will you? If they don't have a continual source of readily available food, they get into trouble pretty quickly. Human beings did wander away from the tropics, and that was one of the reasons we were able to do it.
So what is the mechanism, though, just to follow up, that makes it so that fasting lowers inflammation because you lose weight, and then it also can help with cancer, something very different from...
Just like when we look at visceral fat as being kind of tumorous, you don't just, if you lose 10% of your body weight, you don't lose 10% of your visceral fat. You lose disproportionately more visceral fat. Why? Because the body breaks things down in inverse proportion to its needs. So if you go on a fast and lose 10% of your weight, you may not lose 10% of your lymphoma tumor. You may lose 50 or 100% of your tumor, as we've demonstrated in reports we've published, including in British Medical Journal case reports. So the body's ability to break down some tissues versus other tissues is an important part of the adaptation to fasting. And so some tissues, like nervous tissue, is preserved, and fat and visceral fat particularly growths and other problems are preferentially mobilized. And so that's one of the tricks we're able to use is you put a person on a fast and get the body to, it's like if you think about a computer, you know, sometimes you're using your computer, it becomes corrupted and you don't know, it doesn't work. You shut it down, you turn it back on, and now all of a sudden you don't know why, but things are working again. Well, essentially, that's what we're doing with the human being when we fast them. For one thing that reboots is the gut microbiome. You know, you have 5 pounds of creatures living in your intestinal tract. We're talking 1 trillion creatures, bacteria, protozoa, et cetera. And in a healthy person that's on a whole plant food diet, they have maybe 1,000 different strains of organisms working together to protect you immunologically, to produce essential nutrients. If a person, say, for example, is on a greasy, fatty, slimy, dead, decaying flesh diet, where they're dominated by meat and fish and fowl, eggs and dairy products, they have completely different organisms and completely different poo from those organisms. Because you think those creatures are swimming around eating, drinking, and defecating inside you right now. And what they poo in you depends on what you feed them. And so if you feed them plant-based foods, you're going to get fertilizer like vitamin K and things you need. You feed them the dead Dr. Atkins diet, may his soul rest in peace, you're going to get the kind of bacteria and the kind of waste products like TMA, which is trimethylamine oxidase, which causes associated with heart disease and cancer and problems. So this microorganisms that live in the gut are profoundly affected by fasting. So you get a big die-off, and then if you put the right prebiotic formula in, that is diet, vegetable cellulose rich plant-based diet, you grow normal organisms back, which is probably why we see such good clinical results in bowel-related conditions like ulcerative colitis and Crohn's disease, but also why it may be affecting seemingly unrelated conditions like depression and anxiety, where, you know, a major part of the neurochemicals that are associated with dopamine, serotonin, and whatnot are produced actually in the intestinal tract. We also see profound effects on conditions like high blood pressure. High blood pressure is one of the leading contributing causes of death and disability. And we did a study that's described in our book, 174 consecutive patients with hypertension, 174 people normalized pressure without the need for medication. We have the largest effect size that's ever been shown with an average drop of 60 points in stage 3 hypertension. Essentially, all the essential hypertensive patients that fast will eventually normalize their blood pressure. And if they're willing to do the whole plant food diet, they can maintain it.
How long did they need to fast, for example?
These fasts will range from 5 to 40 days. It depends on how much visceral fat they have. It depends on how high their blood pressure is. It depends on what other concomitant diseases they have. But the fasting ranges from 5 to 40 days, but the typical fast is 2 to 3 weeks. So the typical person coming in, they're 160 over 100, they're on a couple of blood pressure medications. These people will have normal blood pressure without medications by the time we're done with them. And yet medically, that's not true. Medically, the doctors will tell them, listen, you'll be on these drugs the rest of your life. We promise you, if you do exactly what you say, you'll never get well. You'll be sick forever. And because there is no getting better from high blood pressure, diabetics are told the same thing. You'll be on drugs the rest of your life. Autoimmune diseases, you'll be taking these drugs the rest of your life. Cancer patients, we're going to do all this therapy, but you're never getting well. So, I mean, the reason is because they're not dealing with the reason why people are sick, which is the dietary excess that leads to the fat, that leads to the visceral fat, that produces the inflammation that causes them to be ill. This is a different approach. It's resolve the inflammatory products with fasting, do the diet and lifestyle changes so you can maintain the results. And people that are willing to do that, as we've demonstrated in over 20 papers now published in peer-reviewed journals, you can not only do it while you're fasting, but you can sustain that. People are capable of making these diet and lifestyle changes.